everybody. This is Carrie Harris, who's with us from the University of Montana, and we're really excited to have her. It was a great class yesterday, and gathering public input is something more and more of us are doing in ways small and large, and it is really very helpful to kind of have a great overview of how that works and how you can do it really well. And we're really glad Carrie's here. Thanks so much.
So happy to be here. Yeah, thanks for inviting me.
And I'll just remind you, this is being recorded by MCAT, and so just speak up when you ask questions or announce something. So that's it.
All right, good. So I'm so happy to be here from the University of Montana, and I'm in the School of Public and Community Health Sciences. And I wanted to give a little advertisement for a program because we have a master's in public health that Alicia is in that's completely online. And yesterday we had a new program approved that's a master's in public health. It's going to be an on-campus program with health and human performance. So those of you who are more interested in having on-campus classes, it will be kind of a blended program. And we also have approved a PhD in public health. So those of you who are interested in moving past the master's, you have a home at the University of Montana. So we have a certificate program too. That is my entire advertisement. I thought it might be helpful to go around the room and do a few introductions. I'd love to hear about your name, where you work, and a little bit, maybe one or two sentences about data that you're interested in collecting as public input. So what kind of public input is in your head right now as you're thinking about this class? So let's start with you.
Oh, sure. Well, that just means you're second.
Yeah, just get it over with.
Yeah. April Thorson. I work in the Environmental Health Department. I support mostly the land sanitarians, but also with the food and the water and the air. And I'm interested in how we can help the public understand more of what we do.
Okay, great.
My name is Shannon Terrio. I'm the Director of Environmental Health, and April works in the one program where we've been successful at gathering public and using public input in the land program, so we're interested in figuring out how to do that for more of our regulated public communities, and always find ways to increase, to improve our program when we ask, so we're excited about that.
Excellent.
And specifically in Sealy Lake, where we have an air quality problem, and it's sort of difficult to get the community to respond to us, so we are interested in figuring out how best to do that.
Okay, good. Let's hear more about that as we move along. Kara.
Kara, and I'm a nurse home visitor down in the Nurse Family Partnership Program. And we've been thinking a lot about referrals, and we don't feel like we're necessarily reaching all the referrals that could be eligible for our program. And so that's a little different, but I think getting input on what are the barriers to that and attitudes to that.
Good. Interesting.
I'm Leah Hickey, and I'm in environmental health too. I'm a land sanitarian. And I guess kind of building off of, we have so many answers. But
I should have said it from.
yeah, I know.
Tell us more about what's been working.
Well, I think something that we could, we're just kind of in preliminary steps of trying to find new ways to do public education and digging into, what actually works best, like for the public, but what do they want to see, what do they feel like reaches them? Because we're kind of
Feel kind of in the dark about that.
yeah, we can do a lot of things, but we want to be able to reach them efficiently. So.
Oh, great.
I'm Brad. I'm a nurse in the infectious disease office, and I also am on call in the immunization clinic. And as far as research, I'm really interested in qualitative phenomenology, and specifically looking at to what are people's conceptions of the good life, and then what are the barriers, how come they're not living with their own values.
Interesting. Yeah, Alicia?
I'm Alicia Johnson, and I'm in environmental health. And I am interested in raw milk, of course. I've been working on a project for raw milk. And the other place where I'd like to get public input, hepatitis C is a problem in the United States, and trying to figure out what people's perceptions are as far as the risks What are the barriers for testing, things like that, so we can better approach hepatitis C intervention.
Okay, good. I hope you'll tell us more about your project as examples come up for you. Yeah. Hi.
Hi, I'm Dana Kingfisher. I work at the Missoula Urban Indian Health Center.
Hi, Dana. How are you?
Good. How are you?
I'm good.
Good. We provide an array of services, and I feel like we don't get a lot of public community input, and we write a lot of grants, and we need research, we need data, but just want to get the public's opinion of what we should do. Because you could provide all this stuff, but if nobody comes.
Mhm. So kind of preferences, service
Mhm.
preferences. Good.
Mhm.
Okay.
I'm Lisa Viskevich. I have 3 hats: Let's Move Missoula Coordinator, Health Promotion Supervisor, Missoula Invest Health Leader. And my interest, and we're actively doing this right now with our Missoula Invest Health project, is to look at holistic behaviors of people and how they make choices for physical activity and nutrition, where they live, work, and play. And we've conducted 3 neighborhood walkabouts in our low wealth neighborhoods, because what we see is that the health disparities in those neighborhoods, we have higher rates of depression and obesity in comparison to the rest of the city of Missoula. So I'm curious, when we get the information,
What are you going to do?
what are we going to do with the information? So,
yeah. Oh, that'll.
but we wanted to really be thoughtful and make sure that we got their input before we did a project.
Okay,
So-
good. It's a great time to
Mhm.
think about it. Yeah. Thanks.
Hi, I'm Kate Devono. I'm the manager of the Awaken Nutrition Programs. And there's a lot of things that I think we want to know. And I think Lisa touched on a little bit too, just kind of when we're looking at trying to change a culture and change what people value about nutrition and their habits, trying to kind of figure that out. How do we measure that? And I think gathering public input about how they perceive, what they perceive as good nutrition, what they perceive would be feasible to make changes, those kinds of things. That's harder to, I think, put your finger on and specifically measure. But the other area that we're particularly interested in is within the WIC program, we have fairly low participation among those who are potentially eligible. And so trying to find out for those who do participate, what do they value? Why are they coming to the program? And then for those who are not participating, what are some of the barriers and what can we learn from that to improve our services?
Great. A little bit like what Kara was talking about, tiny bit.
Yeah.
Yeah, good. Hi.
And my name is Debbie Hirschberg. I also work for the WIC program, and Kate said most of that. I want to better serve our participants, and I think that eligible participants that aren't participating and the ones that are, and I think that they're the experts on their lives and their families, and so how can I use that information that they have to be a better WIC worker
Right.
for them and for the community.
Great.
I'm Pam Burgess, and I work in health services doing the billing, and I can't say I really have any goals. I saw the email come through and I just thought it sounded interesting. So
I'm so glad you're here.
everything
Yeah. Okay.
that everybody has to say.
Good. We have a whole range of people. Some like Alicia could be teaching this class and some folks that are new. That's great. Good. Hi.
Hi, I'm Katie Cleats. I'm the communications coordinator for Missoula County, so a lot of this is probably going to be over my head. I don't have any sort of health focus whatsoever, but I do get the opportunity to work with all of our various departments at the county, so I'm interested in just learning more specifically how you're in the weeds, and then once you come up, how I can then maybe take that more of that information and
So
share
glad
with
you're
the
here.
public.
Yeah. Yeah. Good.
Yeah.
I'm Marcy Lewandowski. I intern with Katie at Communications and Projects. I'm an MBA and an MBA student, and I also do graduate research for the Department of Health and Human Services. And I think I'm just interested in learning more.
Good. So nice to meet you.
Yeah.
We've been on emails together, a lot of emails. All right. Hi.
Okay, I'm Whitney Meek, and I work down in health promotion in the cancer control program. And I, kind of like Lisa, have several different hats within that program. One being at the Montana Cancer Control Coalition, and I recently took the co-chair position of one of their implementation teams. So that is a project that is reaching out to the whole state.
Oh my.
And it's a really big project, so I feel like this could be very valuable in that aspect. And then also I go into work sites and do worksite wellness. So I'm constantly trying to find out what employees want, and each different work site is so different, so learning just different techniques on how to gather that information would be helpful.
Well, that's interesting, a little different than the rest of folks. Yeah,
Yeah.
good. Hi.
My name is Timmy and I actually work in health promotion too. I help support all the local initiatives within health promotion, so really helping Whitney out and helping Lisa out, what I can do to help. Yeah.
Any burning questions about that you want public input on?
Like I said, mostly just to build upon what they are and help them out and what they know.
Good. Robin, does everybody know you?
Except for Marcy, the intern.
Okay, all right, good. And Ron, right? Thanks for being here. So we have a lot of rich questions that I think we can draw on for examples, which will I think really enhance the class. So thanks for being here. I wanted to just tell you what my plan was too, and let's incorporate your questions as we go along. This is a small group. It's really, my plan is to have more of a workshop than a straight presentation. The first thing we'll talk a little bit about is qualitative research, and set that in the context of other research methods. Robin asked me to specifically talk about focus groups, so we're going to drill down in on one qualitative method, and that's focus groups. We're going to spend some time talking about designing questions for focus groups, how to conduct a focus group, and we're going to spend some time, maybe not as much time as you guys might like, on analysis of focus group data. So that is the plan. This, I made a little worksheet, so I thought we might talk a little bit, and I could share some ideas with you, and then you could plan a little bit, one focus group between the folks that you're sitting at the table with. So you can go away with a plan that may not be exactly a plan that you would implement, but would be similar to one you might implement, just to kind of go through that thought process. So that's what this piece of paper is about. And the back of it is actually a checklist for conducting focus groups that I thought might be helpful to have in your files. Does that sound like a good plan? All right. Good. So let's, I want to situate qualitative data in all the different sources of data that you have available to you and access. And first is existing survey data. And I think you guys are excellent at using existing data. And I think anytime you have access to existing data, whoa, use it, right? Like if you can find data that's relevant to the question that you have, that is by far the best use of your resources, is to use existing data. And sometimes there are data that you collect that you don't summarize or haven't summarized, but you could potentially mine for the question that you have. And I think we could probably think of some examples, and perhaps on your intakes, some of your intake information, you may ask questions that you actually don't summarize but may help inform the kind of questions that you have. So in some ways that's kind of file drawer data that you can think about as you're thinking about your problem. Is there any data that you collect that isn't already analyzed? Another source of data is direct observation. I actually think, I was really excited to hear about your walkabout, because in some sense that's observation, that's community observation. And I think we underutilize direct observation. We did some studies at the University of Montana. We wanted to understand better how many smokers were smoking in non-compliant areas. And we could have gone around and asked students, but what we did is went and watched and counted. And that was a good way, a fairly efficient way to answer that question. So direct observation, I think sometimes we can instead of asking people, we can observe what's happening. And that's a really good strategy. We can design new surveys using maybe existing questions and ask people to fill out surveys for us, which I think sometimes is a good strategy. And you guys have access to people in waiting rooms who are, my guess is, going to fill out surveys, so that's good. I'm a pretty big fan of single item surveys, where you might just ask one key question and ask for responses. and then analyze those responses. And if you can drill into the question that you have, sometimes you can get a lot of information by asking just one question. I'm going to talk just a little bit about a study that I just finished where we were interested in why smokers who are not motivated to quit would enroll in a smoking study. And we thought we'd have a lot of trouble with recruitment. Turns out we didn't have trouble with recruitment. But we asked in one question, we asked, why were you interested in participating in the study? And we left 3 lines and people filled that in. And we learned a lot by just asking that one question, one key question. Another source of data that I think might be useful, especially for you guys to think about, is individual surveys, or excuse me, individual interviews as an alternative to focus groups. Usually the logistics of an individual interview are easier to manage, and you can schedule them directly with a participant as opposed to having a group to come together and half the people don't show up and it's difficult to coordinate schedules. So individual interviews, I think, is when a focus group and an individual interview is kind of going to give you the same information, I'd recommend to think about an individual interview because the logistics are easier and it's less respondent burden as well. And then finally, there's the focus group, which is similar to an individual interview but has some special unique features. So when we think about these types of data, they really fall into 2 categories: quantitative research and qualitative research. And qualitative research is really about people's subjective experience, right? That's what you guys talked about when you talked about public input. It's what people's perceptions are and their understanding of meaning, okay? So lots of times we contrast qualitative research with quantitative research, right, which is more survey data, prevalence data. And usually that's kind of a mile wide. You can find out a lot of information, but you can't find out very much. It's very, very narrow in its depth, but wide in its breadth, right? Like think about the YRBS questionnaire. Whoa, you get to know about every single risk behavior a kid might engage in, but you don't find out very much about it. You find out what happened in the last, how often they engaged in that behavior in the last 30 days, in the last year, but you really don't understand, you don't get any more deeper meaning from that. But you do find out how frequent it is, right? That's a good way to do it. So qualitative research is usually about a pretty narrow topic, and you go very deep into that topic, and that's what it's good for, right? Qualitative research. So really digging down deep, and it's more about answering the question, what is this all about, rather than how much, or it's all how much. In reality, actually, oftentimes we use mixed methods, right? We talk about these as totally separate, and there's one book about qualitative research and one about quantitative research, but oftentimes qualitative research informs quantitative research, so you might ask questions and want to learn more about a particular topic, maybe why providers do referrals and why they don't, and then you might generate a list of reasons, and then you might do a follow-up survey to see how common those answers are. So oftentimes these are used in a mixed way, and I've become a qualitative researcher, although most of my research is quantitative, but before I do a research project, almost always, it's like when you roll out a new program, we want to talk to participants, we want to go over some of the issues that we think are going to be tricky in the research and get the advice of the participants of whether that's going to work or not. One example, one of my first studies, I did a placebo-controlled trial in an African-American community. So we wanted to give a placebo pill. We were pretty worried about how that was going to go over given the history of research in the African-American community. So one of the things we did is had a focus group and talked with potential participants about the idea of a placebo-controlled trial, what their thoughts were about it, what their concerns might be about that, and what made sense to them in terms of a rationale and what didn't make sense. That was very useful. We ended up doing the placebo-controlled trial. It was to compare the effectiveness of bupropion against a placebo for African Americans. So it was really very much a quantitative study, but we used the qualitative approach leading into the study. Does that make sense? So we talk about them as if they're totally separate, never the two shall meet, but it's actually not that separate. So when do you do qualitative research and when to do quantitative research? In some ways, I think this is the biggest decision point you might have as you think about your data and what data you want to collect. And here are the reasons. This is, I guess, my list, why I would think about doing a qualitative study. When the topic is so very new, either to the team or to the literature. If it's new to the team, I would say the first thing you might do is go take a peek in the literature. What other people learned about it? And you might be able to learn from the literature. Sometimes we don't understand all the dimensions of an issue or a problem. We may not understand all the reasons why someone might participate in WIC or they might not, and you may need to understand all those dimensions. Sometimes we have very unique settings, right? Settings we haven't worked in before that are totally new, and we may want to understand better about that setting and the population that lives in it. Almost always we use qualitative research in cases where we want more depth and shades of meaning that you just cannot get from people circling a number. And this is probably the most common reason why I do qualitative research is I don't quite know what the question to ask yet. So I need to learn more from the participants so that I can then either make a modification or then follow up with quantitative questions. If you do know the question to ask, and it's a response that can be codified in a questionnaire, you might as well just ask the questionnaire, right? Because this is getting the qualitative rich data is quite a lot of work. And if you already know the question to ask, I would suggest going ahead and asking the question. If you're doing qualitative research on a question you already know the answer to, it's not really worth your time, because what you're doing is you're getting depth of information, but you already knew the question already. And if you could ask the question, you would get a sense of how common the responses are, which is probably what you want at that point. So if you find yourself already knowing the answer to the questions you're asking, and you really do know the answer, then you may not want to be doing qualitative research. So it's kind of a decision point when you're thinking about the data you want to collect, whether it's quantitative or qualitative type data. So what about a focus group? When would you use a focus group? What is a focus group? Let's talk about that. It's always focused on a specific topic, right? It's not just a general conversation about what are in people's minds at that time. It's focused. Typically, participants have some special characteristic that you're interested in particular. Maybe there are people who are eligible for services but aren't using those services, right? So they have a specific characteristic. Always conducted by a trained facilitator, and that may not be the person who's most interested in the data. As a matter of fact, sometimes I think it's better done by someone a little bit removed from the project. And this is one of the most important things, is that as a research team or as a team of people who want to gather the information, what you really want is you want to understand what's happening in the discussion, right? And the discussion between members, people's responses to each other's ideas. If you're not really interested in that, you might think about moving to an individual interview if there's not a reason why you're interested in the dynamics of the group. And so when to conduct a focus group as opposed to other qualitative approaches, again, you're interested in that interaction, the group dynamics. Some people talk about focus groups as dropping a pebble into the water and watching the ripples and listening to the ripples, right? So you're interested in what that conversation leads out to. You're not really interested in the one answer when you drop the pebbles. If you just wanted the one answer, what kind of study would that be? Would that be qualitative or quantitative? Quantitative, right? Sometimes you want to widen the range of ideas. And through that conversation, people kind of bounce ideas off of each other. And you've seen that happen, right, when you're having a meeting. Somebody has a good idea, and that reminds you of, oh, yeah. I mean, that happened yesterday in our training. Mary McCourt thought of all different kinds of experiences she's had in qualitative research while we were having our meeting. It reminded her of a whole bunch of other things. And it really generated more ideas for her. So that can definitely happen. Has anybody ever been in a focus group or sat in one, participated in one? Do you remember that happening when you were sitting around the table and somebody had an idea and it kind of, oh yeah, that reminded you of an idea or made you think about another idea? Yeah. Yeah, good focus groups do that. People's ideas can help you remember what happened. One technique for focus groups is think about the last time you enjoyed your appointment at WIC. And people can think back and report back on that experience, and that reminds other people about details that they may have forgotten, so it can help people, remind people. And finally, in some situations, a group can make people feel more comfortable. This can go both ways, it depends. But we were talking yesterday about focus groups of parents and having the common experiences of their kids watching too much screen time. And I think that's a very common experience a lot of us parents have. They end up watching more iPad, iPod, phone than we'd like them to. And so the group opening up about that can help people feel more comfortable as opposed to an individual interview where you might be embarrassed to talk about how much time your kid spends watching screens. Make sense? Okay, so let's work in small groups at your table, and between the folks at the table, pick one issue or problem that might be suitable to explore in a focus group. And so kind of discuss among yourselves, pick one thing that you think, oh, this might be good for a focus group, and we'll go ahead and plan questions and other things for that focus group. But first, think a little bit about a topic. Is this more of a quantitative or a qualitative type question? And see if you can come up with some ideas for a focus group. Go to it.
What about the milk?
Okay, good. All right. Well, let's hear what some of these things are. Did you guys get something? All right, good. So let's just hear a couple of issues that are suitable for a focus group. Which tell us.
About training needs. So I guess for me specifically, working with people with disabilities, what they need in terms of support for communication or different areas, and that could be built on by other group members versus just if I was asking one person what their needs were.
So maybe that group dynamic would really help people think about other ideas.
Right. If you don't know what you don't know.
Yeah. Okay, good. That's an interesting topic, yeah. What other ones? One other one. Yeah.
Barriers to youth receiving 60 minutes of moderate to vigorous physical activity daily.
Is that what you want to know from youth or from someone else?
Well, from the parents of youth.
From the parents of youth.
Mm-hmm.
Okay, good. Anything in the literature about that?
Probably. But I think for them to, kind of like the screen time, we know it all exists.
Yeah.
So we need to all come together with solutions.
That'll work for.
And then we can take those solutions to stakeholders and say, this is the problem.
Good.
Solutions for Missoula County, because Missoula County is unique in itself, so
Yeah.
figuring out.
Well, and especially, I mean, with vulnerable populations as well.
Bingo, right? There are some populations that have a harder time than others, and that might be particularly important given that you talked about the neighborhood, specific neighborhoods that you're working in may have different issues than others.
Mm-hmm.
Maybe masked by the idea that, oh, everybody in Missoula's active. We know that's not true, but you look around, you see a lot of people riding bikes and walking, and that's not the same in every neighborhood.
Mm-hmm.
Yeah, good.
I think there's another component to that though, is that our screen time as parents too, with our smartphones and like, and our screen time at work and at home. I think that's a really,
Oh, it's huge.
I think that would be part of the question too, because it's easy to
easy to avoid that.
It's easy
Avoid
to
that
think
as a
about your
parent.
kid, but what are you modeling?
Yeah,
for?
what the modeling.
I think she needs to be in the focus group.
Let's do it.
Yeah, I've been in some focus groups with college students who smoke, and there was one focus group, people got so excited they were ready to take action. It was very, I mean, it's not an action, the point is not action, but this kind of thing happened where people are like, oh, well, maybe we should set another time to meet, and they got very activated on talking about their smoking. Yeah, doesn't always happen, but it's kind of a surprise. It can happen in a focus group. All right, good. All right, so let's keep those ideas, and we're going to work on them a little bit more. So let's talk about group composition for a focus group. People ask, well, how many people should be in a focus group? And this is kind of a rule of thumb, 5 to 10 people. If you get less than 5, sometimes you lose that kind of popcorn effect where people are bouncing ideas off each other. And if you have many more than 10, it's hard to really listen to everyone, and you may end up losing the value of having more than 10 people there because you can't listen well to their ideas. The rule of thumb about how many groups to run is 3 groups, which is resource intensive to run 1 group and to run 3. And the idea there is that sometimes you may get a group that has a really strong personality, or someone has a really strong idea that it's the parent screen time, and that is the entire group might talk about that. And if you ran 2 more groups, you might get more diverse ideas. So 3 groups is the rule of thumb, but the best way to decide how many groups to run is this idea of saturation, which I bet some of you know what that is, the idea you don't learn any more. So you run a group and you learn absolutely nothing that the other groups haven't already talked about. And then you've done enough groups, right? You've talked to enough people, you've analyzed enough data, you're not learning anything new. So that's the ideal. And a really important thing is to avoid power differentials in your focus groups. There's been a situation in the African American community that I talked about where we ended up with a minister in our group, kind of accidentally. And let me tell you, that whole entire focus group was about the minister's values and perceptions, and that's the way it needed to be given what happened. But that is not an ideal situation. So thinking about principals, bosses, people with PTA leaders who may bring unequal power distribution to the group that's going to suppress some people's ability to feel comfortable talking. So that's a really important thing to think about. What would you do if you wanted to get the ideas of ministers? What might you do?
Have a focus group of ministers.
Have a focus group of ministers, good. What else might you do? That's a good idea. You might want to hear
Individual
individual interviews. Maybe there's just a couple of ministers, maybe there's just a couple principals, and you may need to get their information totally separately. Sometimes you don't know, right? Things happen. Like the minister came, we didn't really realize that was going to happen. And we'll talk about a moderator, and boy, that makes the moderator's role really hard when that does happen. The other thing to really think about is similarities in your group members. So you want people to be similar enough that they feel like they have things in common with the group, but you don't want carbon copies, 10 exact same people, because it doesn't really widen the ideas. So you want a little variety in your focus groups. And when you have, I think about your issue with physical activity around all of Missoula, you're probably going to need to stratify by important characteristics, because you're probably not going to talk to everybody at the same time, because their characteristics are going to be so different. Do you have some sense of how you might, what are some important groups that might have totally different ideas?
Well, people with disabilities, the elderly.
Yes.
People with small children.
Yes. They might have completely different issues. Yeah. Yeah. And ideally, you hold a series of groups with each of those types of participants, and ideally, you hold 3 of them. for the same reason that you might have 3 focus groups. And why not 2? You can imagine you might get 2 very different groups, and if you get a third, it kind of gives you a sense, oh, this is what they're mostly all going to be like. So some about group composition.
I have a question.
Yeah.
So talking about running a focus group and having like a dominant voice in the group and then having a couple introverts because you want to keep it diverse. What are some good tips of bringing out the voice of the introvert?
Do you know that going in, that you have
No.
that? Okay.
No, it presents
Yeah,
itself.
yeah.
And, you know, you have a person there.
Yeah.
That's just,
How do you moderate that?
Right.
Yeah. Yeah.
What's a good word or tip?
What I've heard moderators, skilled moderators do is say things like, that's a really excellent point. Let's see if we can hear from someone else and see if they have some other ideas. Or does anyone else agree with Joe's idea? And move it off. And I'm going to talk a little bit about questions and how you set up the very first question, because that can help set the stage that everybody's voice is important. Sometimes people can do it really good. Facilitators can do it with their body, right? And so they don't look at the person who is contributing more. That's also another strategy. I've seen moderators go and sit right next to the person, right? So that they can turn away and look at the rest of the group. Yeah. Picking a good moderator is important, right? And these are not easy things to do, especially on the fly.
No.
Yeah. But it's important because otherwise you lose the voice of the people. Yeah, Kara.
What if you end up with smaller than 5 people in the focus group? Can you still, does that still count?
I think it does. Yeah, I think it does. Sometimes that happens,
Yeah.
right? And I think it's happened to me.
Yeah, I was thinking of folks.
Yeah.
Just 2 of you.
Just 2 of you. It's hard to bounce ideas off each other, isn't it? It becomes more like a conversation. Yeah. I think it's not ideal, but I think you can still learn. Like, I wouldn't cancel the group because you just had 2. I would go try to get some more. But I would say, well, that's kind of a little bit between a focus group and an individual interview. Yeah, it's kind of interesting that all these things happen too, right? I've had another problem that I've had is where too many people show up. And that's a little easier. And I actually like to thank people very much and pay them if I have an incentive and say, whoa, you've got an hour and a half to 2 hours more out of your schedule that you didn't think you were going to have, and not have them come into the group. Yeah. But maybe better to have the more problem than the less problem. So what about recruitment? I think you guys probably have some really good ideas about that. I think incentives work. My guess is that's hard in a setting like this, where you may not have access to incentives. But if you are able to give like cash incentives, which is cash great, right? Great thing. I think it's important to think about the hourly income of the people that you're inviting to the focus group, and in some ways you're paying them for their time, right? Which is a reasonable thing to do if they're giving you information that you want to find out about your program, is to pay them for their time. Sometimes they're invested, right? They're interested in improving their school or their neighborhood, and it's less of an issue, but sometimes it's really about what you want to find out to improve your program. And I think when you can, pay them what their hourly rate is. But that's ideal. We can't all do that, right? So what about coupons, gift certificates, raffles, right? Kind of getting to the gambling thing, that can be effective too. Ask employers to help with paid time off work, or be able to conduct the interview into intact groups that maybe they're at their kid's school, or they're already at work, or there's some place where they're already gathering. Maybe they're all go to the same church. Could cause some problems too, though. But getting people where they are. Food, it's a good social lubricant, right? And I've heard people say you should never have a focus group unless you have some kind of food, because we're also accustomed to talking around eating in our culture, that it's a great thing if you can offer a meal and have a conversation around a meal. Can't offer a meal, snacks are good. Yeah. And so the other side of incentives are removing barriers and keeping the barriers as low as possible. And sometimes I think that these are one offsets the other. If you have really high incentives, you can have a few barriers to get into your focus group. But if you have no incentives, then you better make it as easy as possible for people to participate. Thinking about the timing, transportation, childcare, I think is probably an issue for you guys. And familiar public setting, which you have access to here, which is good. So I don't know, Kara, if your focus group would have over-recruited, maybe they did, but if you recruit, I usually think you want to recruit, again, as half as many as you want. So if you want to end up with 10, invite 15. It really varies by population, but my experience is over-recruit by at least half. And then if you really want to, you can always think about turning people away. If culturally that's appropriate for your setting, you can think, oh, we're going to have a few more. And if we get extra, we'll just be happy to send them on. Does that make sense? All right. So let's get into the actual focus group itself. So you've got a issue that you're interested in, it's appropriate for a focus group, you've figured out how to get people there, and you've got the right people coming. What happens when you get in the room? Here's some preliminary things that can happen or that should happen. If you're doing this for research and you're going to share the results with the broader community, especially the scientific community, you're going to have some consent forms and you're going to let people know in writing how the data are going to be used. You're going to right off the bat thank people for coming, let them know the purpose and goals. Don't want to keep that a secret, right? Let them in, let them know what's going on. It's important, just like any other meeting, to give the logistics of the meeting and or the group and how it's going to proceed, when you're going to take breaks. This was very important when doing focus groups with smokers, right? So it was really important for them to know when the break was coming up and where they could smoke. And certainly, I don't know if I'm a former smoker, and anytime I have a conversation, intense conversation about my former tobacco use, wow, does it make me want to smoke? So for smokers, anyway, can really activate that. And because you don't want them thinking in the meeting about this one logistic, right? You want to help let that go. And we were talking about what to do if one person is dominating the conversation, and one thing you can do right off the bat is set the tone of the meeting by asking a question that everyone in the group can respond to, and being very careful to listen to every single person as they respond. And that sets the part of the tone that all opinions are important in this group right off the bat. And here's the kind of rule of thumb for how to ask questions in a focus group. It is fairly good consensus that this is the route that is ideal. The first is to ask that opening question that gets everybody engaged and one that everyone is going to answer. The second is an introductory question that's kind of a softball question, but gets people into the topic that you're interested in. The focus group is about. And then this is in kind of the middle of the focus group. It's where you're going to ask those key questions, and you're going to ask 3 to 5, and 3 is probably better. 3 absolute things that you want to learn from that focus group. And you're probably going to spend about 20 minutes in each of those 3 key topics, 15 to 20 minutes. Ideally, you write some probes and follow-up questions, because sometimes you drop the pebble in and people don't have much to say. So you want to make sure that you have designed some probes so that you can ask some follow-up questions, and a good moderator will want to follow up on some of the things that people say as they come up too. They may want to ask clarifying questions, and that's good to have some of those models. And then some kind of ending question where you really put a period to the focus group, and usually it's a very broad question, like all things considered that we talked about here today, or what else do we need to know that we haven't asked about. And many times you're going to have someone who's taking notes in the focus group. I'm going to talk a little bit about different ways to analyze the data, but one strategy is to have a note taker. And then at the very end, what you want the note taker to do is summarize the key top level thoughts from the group. It's a hard role to do. Sometimes groups have 2 note takers. Sometimes it works well to actually stop the focus group in between each of the key questions and ask the note taker to summarize for that section, and then what you want to do is ask the group, did we get it right? Is this accurate to what this group said? And sometimes people will add some things too. So it's good to leave a little extra time because it might kind of spur people's thoughts, right? Oh, I had another thing I wanted to say about that.
Is it okay to record those? Like do a voice recording so you don't miss something?
That is a really good strategy. That is a really good strategy to do an audio record. If you don't have the resources to do that, though, what you want to do is you do want to have someone summarize and check with the group, because it's hard to summarize, isn't it? It's hard to get the main points. You want to make sure you have it accurately. Yeah, audio recording, if you can, is a super good strategy too. And then maybe you're summarizing it even could be the moderator summarizing some of what the main points were. Just wanted to give you an example of a focus group that I did recently, and this focus group was with parents who we wanted to engage in very brief take-home activities that were connected with their kids' after-school program. And this is an example. We sent home with kids instructions on how to cook a kebab. So these are 3 to 5-year-olds, and we wanted to get parents' ideas about this kind of activity with their kids up at the flathead. And here's some of the questions. Here's the question route that we used. So our opener was, what is the name and the age of your children? So they all had children 3 to 5 years old. Asking a name can be tricky if you're audio recording, but we actually were audio recording and just deleted their names. And so here's our lead in. What activities do you do at home to support your family's health? So it's something that everybody can talk about, right? Everybody does things to support the health of their family. It's one way or another. And it's nice, this is a nice positive intro because people can talk about the positive things that they do. And then we moved into our key questions, right? So we were interested, we knew right off the bat, we knew from the literature, we knew from our own experience that time was going to be a big issue, and we wanted to get at the issue of time. Very busy parents. We asked about obstacles. Do you think we would face? It would have been better if we had asked, what do you think would work well before we asked obstacles? So it would be better if we would have asked that in a positive way. And we're also interested in culture, issues of culture, and so we had a series of the key question about culture. And then our ending question was, what else do we need to know as we move forward?
What was your goal with this?
We wanted to better understand how to engage parents in taking activities that their kids were doing in an after-school program and doing some portion of them at home.
Okay, sorry you said that.
Yeah. And these are the very busiest parents who are working 1 or 2 jobs, and their kids go to an after-school program, and we knew from other that people have to get their kids bath, they have to make dinner, they have their homework to supervise. They're very, very busy. So we wanted to figure out how do we niche it in their lives and get their advice.
You said this was for family with children that were 3 to 5 years old?
Oh, I'm sorry. These are a little bit older kids. Okay. Yeah, we ended up targeting younger kids, but these are a little bit older. Yeah, a little bit older.
When did you do the focus group?
We did these about a year ago.
I mean, what time of day?
This is how do we do that? Well, this was ideal because we did it with the after-school program and their kids were there. So we did it right at pickup time. Yeah, and then we had dinner. And then the after-school program staff stayed and played with the kids.
Awesome.
Yeah, so this was very easy to recruit for. As a matter of fact, we had that problem where we had a few too many people sometimes, yeah. Mm-hmm. And but had we not had food, so we fed the kids, fed the parents so we could help take care of dinner, and the kids had childcare. If we would have had to pull them out and come to another place. It would have been really, really hard. So we kept the barriers pretty low. So, you know, maybe those questions weren't ideal. When thinking back, I think, oh, we could improve them a little bit, but the idea is to have clear, simple, conversational questions. These shouldn't feel like the SAT, right? It should be simple, straightforward. As much as possible, use the participants' language. It's really important with kids, right? But with everybody. This is a no-brainer, but don't ask questions that can be answered by yes and no. It makes for a very short conversation. And then the literature talks about avoid asking why questions because they tend to make people defensive. You know, why are your kids watching so much TV? That tends to not lead to answers that are open and honest. So a tricky thing is to keep the questions broad. Okay, obviously you're there for a reason, but if you drill down too narrowly, you won't find out things that you're not sure that you don't ask a question that's going to get all the responses, the full range of responses that you're interested in. An example might be, what don't you like about, or what are the things that you don't like about the waiting room? Right? That's just drilling down into one area of someone's experience. A more broad question is something like, last time you came for your appointment, what are the things that made you feel uncomfortable? And then, so it's a sort of a wider door to answer the question. So, let's do a little question. Let's think just a little minute about participants for your study that's on your sheet, and then focus on just one of these, figuring out one question for one of these four. Okay? Let's do it in your group. All right.
Okay, how do you?
Good. Did you guys come up with some questions? Did everybody get to questions?
Wetwood or Greenwood?
Yeah, almost. Let's hear some excellent questions. Which group wants to share some of their questions? I think are pretty good. Think that are okay. How about that? Good try for 4 minutes, right?
Well, we can tell.
Yeah.
I mean, so we only got to the opening.
Okay, good. What's your?
We're practically at the introductory, but so we were interested in the barriers and facilitators to changing behavior to reduce smoke emissions in the Sea Lake area.
Yeah.
And it really is a small neighborhood that's probably pretty similar in terms of income.
Mm-hmm. So it's already kind of
yeah,
the target
so
population.
Yeah, so we didn't think that any subgroups were needed, but we tried to think of some and then decided.
What about gender? Is that a relevant issue? Do men and women deal with the stove the same way?
It could be different.
I don't know actually.
Well, actually, there's some stuff in the, there is information in the literature that says that they look at wood stove heat differently. It's based in other countries, but, so we were thinking for an opening, we would ask their name and how long have they used a wood stove and how often do they use their wood stove?
Perfect, right? Everybody's there because they have a wood stove?
Yeah.
Yeah, be kind of interesting. Yeah, maybe. Yeah, be kind of interesting for people to hear each other when they start their wood stove. When they, yeah, good. All right, good. What about another type of question? Any key questions? Any group get to a key question? Alicia, did your group?
Yes, we did. So we were tackling the idea of what makes a happy life for senior citizens. So we kind of drilled down that population. So fully cognitive senior citizens that are kind of facing a big life transition to kind of promote that quality of life. So some of the key questions we came up with are, what are some things that you enjoy doing? What are some things that prevent you from following through with those things? And what are some services that can help you do those things more often?
What do you guys think? Yeah, I think you get some rich information. I wonder about services a little bit because you're a little bit defining for the participant what the solution is, but maybe you want to drill down on that. But sometimes when we ask a question, we embed the answer in it. And that might be a little at risk of that, but maybe you do want to know what services the health department might be able to provide, in which case you might need to give them a range of what they already do. Yeah. Yeah, what gets in your way, and maybe what do you need so that those things aren't in your way? Because maybe they're services and maybe they're sidewalks.
Yeah.
Yeah, okay, good, really good, great. So these are, it's a little out of place, but these are the kind of people that you want in your focus group. And this is ideally have somebody to do the greeting, logistics, and food, right? Really great to have that kind of person. Especially if you aren't audio recording, having a note taker is really critical, or you may have an audio recorder. People videotape focus groups too. But you need one or two of these, right? You either need a note taker or you need to audio record, and you need a really good moderator. But in some ways, if you don't have a note taker, you don't have a recorder, it's kind of as if you didn't have a focus group, right? Because you don't have the data from the focus group.
I just want to put in that I have been involved in the least professional focus groups ever run, and that if you are relying on a recorder, you should also have a note taker, because sometimes technology just isn't working the way you think it is.
Very good point, yeah. I know some people who double audio record, which is another, but having a note taker is always a good idea. Yeah.
Also with note taking, I've learned it's helpful if you track the initial of who's speaking, because as you're going back and you're listening to the recorder, is that Charlie or was that because
it's really hard to tell. Yeah.
And it's hard to keep track of who said what.
It's really hard, isn't it? Yeah, I was when I was preparing for this talk, I was reading other people's ideas and about moderators, and one person said a really skilled moderator will identify the speaker as they're going through the group. I thought, oh, wouldn't that be hard? Yeah.
I also think if you do have a note taker, it should be a third-party person, not somebody who is actually part of the focus group in the sense of
an investment in the outcome?
Correct.
Yes.
Just because otherwise you're trying to participate and then trying to write things down.
They should have no other role, right? And no investment in the outcome. And wouldn't it be great to have two? Yeah. How about the moderator? You think they should be separate from the group?
Yeah, probably.
It's so hard to trust someone with that role, though.
Why is that?
Because you're invested in the outcome, and maybe not even what the outcome should be, but are they doing it like you would want them to do it? Are they missing out on key parts because they're not involved in the issue?
Mm-hmm. Maybe they wouldn't be very good at asking follow-up questions. Mm-hmm. Yeah, to target it. It's a trade-off, isn't it? Yeah. I mean, sometimes you're really, to be a blank slate listener, it's good not to be involved. But having some clue of what the research is about is also a good idea. Yeah. There was someone in a group yesterday who said, I just couldn't listen without getting angry. And I thought, wow, not a good facilitator, right? Definitely don't want that. So let's just talk a few minutes about the skills that you can look for in your moderator, and maybe there's someone in your team, an intern that has these skills, who's trained as in psychology or social work, as an active listener, looking for both those verbal and nonverbal skills, and someone who's really in tune to group dynamics. It's not an easy skill. Neutrality about the topic, right, we were just talking about, and avoiding judgment. And I think the most important one here is really the deep respect for participants, deep, genuine respect for the topic and the participants who are there. And that's not really something that can be made up, right? It's genuine, and it needs to be something that's inherent in your moderator, and then able to control and guide the discussion. Hello. So that's the ideal moderators. I don't think we're going to brainstorm moderators, but I would recommend that you do that as you're thinking about doing a focus group. Brainstorm with your colleagues. Who around here would be a great moderator? Who can we draw in? because I want to talk a little bit about data. So I think about this as a balancing act. If you have more resources, you can have higher rigor in your data analysis. And we don't always have the resources. That doesn't mean that your data aren't useful, but you can have a more rigorous analysis if you have more resources. And what I think one of the important things to do is plan within your resources. If you have no resources to do anything with an audio tape, don't rely on the audio tape, right? Then you really need to get those note takers in there. So let's first talk about low resource data analysis strategies. We've talked about this, having note takers, report back to the group. This is super important. It's called in the literature member checking. So you got some information, now you need to check that with the members to see if it's accurate. And it's really important that when you write your report that you have a couple of people that do that, right? So that you're not having a kind of vested interest, or someone heard that once, but it's not reflective of the entire group.
Can I ask a question?
Yeah.
So when you say report to the group, are you talking about that, hey, did we get this right, just at the moment, not afterwards?
You know, I've seen it done both ways. It's a little labor intensive to do it afterwards, but I have seen some cases where people will write a summary of the report and send it to, maybe it's for community leaders, and they want to ask the community leaders, did we hear all your points accurately? If not, please correct, right? And then they can get it back. I think it's more rare that will work. I think more likely right at the time is a good idea. I've seen people, and I've done this before, where you have a focus group, but you might want to divide people up into small groups and have more detailed conversation, and you can have someone who's taking notes and then checking back with that small group too. So it doesn't have to be exactly all the same. You can have part of a focus group big, can divide people up. The idea is that you give people the chance to correct your summary, that you didn't quite get it right. No, that's not what I meant, and no, that wasn't the main point. Or in addition, we need to be thinking about this. Or you left a really important point out. Does that make sense? It's less than ideal, right? Because you might miss something. And you might run out of time, and people don't have time to correct you. Let me just show you, I'll talk about high resource things in a minute, but in the focus groups that I talked about earlier with the parents, here are some of the key findings, and this is like kind of the big top level findings. We had a note taker, and this is what we found for cultural considerations. Use local experts to help set up the program, such as Indian Education for All, and they gave us some resources we should use. Feature different cultures and language, native and non-native cultures, such as the Irish culture. We asked a broad question, we got an answer we don't really expect, but there was a lot of conversation about respect for culture, regardless of what culture it is. And part of the respect is understanding a variety of cultures, not just one. Provide options such as native games, different words to learn. They were talking about what we might do with those kind of take-home cards, and then also include healthy versions of cultural foods. So that's an example of the kind of low resource results that we got from that focus group in one of the key topic areas. I want to talk some about, in the situation where you have high resources, what you can do with an audio tape and how you deal with that. So you audio record. 2 recorders is good, having a note taker, it's a really good point. You need to then, the idea is then you transcribe them, which is no easy task. Has anybody ever done a transcription? Yeah, terrible, isn't it? Yeah. Especially if you're trying to get a verbatim transcript. And then analyze the transcript. And I'm going to give you an example of actually the kind of the end result. So this isn't a top line report. This was kind of in a high resource area. This was part of the study that I told you about, where we asked people, why did you participate since you're not interested in quitting smoking, why did you participate in a smoking study? Did I introduce that already? Okay. So we asked them that at the very beginning of the study when they were being recruited. So what about this study interests you? And then we actually, it was open-ended questions, and then people could fill in 3 blanks, so we could have up to 3 responses. And we then took each of those responses and we developed coding categories. Okay, so here are 2 of the coding categories: education and insight, and quit assistance. Okay, so those 2 things emerged as we actually had 12 themes, but these are 2 of the main codes or main themes that emerged from those short answers. Some ways what you can think about it as card sorting. This is the way people used to do it. You used to take every little piece of data and try to sort them in piles, right? So it's kind of a data reduction technique where you're looking for what are the main issues that were talked about. Then you write definitions for those main issues. So for quit assistance was one of the codes, and the definition for that is to help quit or change smoking, or information about how to quit smoking once the participant is ready to quit. Okay? And once you create the codes and the definitions, then you code your data, and you oftentimes find, guess what? More codes you need. So then you have to develop more codes and then resort your data again. Very common to have to do that. And let me just, oftentimes when you're reporting data, you'll report the actual words that participants said that go along with the definitions and the codes. And here's some examples of some things people said when they reported that they participated in the study to get help with quitting. I'm interested in eventually quitting smoking, to get help to try to quit, interested in new quitting smoking techniques. Okay? This is, it's a little bit controversial, but we coded the percent of participants that gave this reason for quitting. And so 23% of the participants listed quit assistance as one of their reasons.
Why is that controversial?
Some qualitative researchers say, that how often people mention something is not a reflection of how important it is. And you can imagine that might be the case sometimes, right? In this case, I think it's appropriate. We wanted to know how many people. We didn't ask people to endorse. We wanted to, it was an open question. We wanted to know, well, how many people mentioned something like that? But sometimes in a focus group, you might have an idea that comes up that's just mentioned once. Everybody has this response like, oh, yeah, and a lot of nodding, but it maybe was only a small part of the focus group. So you can see in that case, it may not be reflective. Yeah, true qualitative researchers would not do this. And I wanted to just give you an example of how qualitative and quantitative data can be used together. Remember I told you that this was part of a study to help people who are not interested in quit smoking. Let me just ignore that for a minute. So this is really a mixed methods study that I'm showing you. And we did some regression modeling to predict the outcome at 26 weeks based on the reason why people said they wanted to participate in the study, because we thought, well, maybe the outcome will differ based on why they got into this in the first place. And it did. People who mentioned quit assistance at the beginning of the study were at 26 weeks, had a higher motivation to quit. They weren't quit. And importantly, they were more likely to make a quit attempt if they came into the study with some interest in quitting. Making us think that just because you have a study for people who are not interested in quitting, advertising the benefits of quitting is a good idea for that. So it's something we learned and reported in the literature. Let me just go back up here to this agreement between coder and business. So you can get bias in how you classify responses, right? That makes sense. So the strategy to deal with that, so that the readers of your report can say, oh yeah, I'd probably classify that in the same kind of way, is that you take many instances and you have a second person apply the same coding scheme, right? And you're looking for having a high agreement in how people classify those two, how they classify responses. So lots of times here, Kara can talk about this ad nauseum, but in a project we were working on together. But here are sometimes where you have to go revise your definitions again, right? Because you thought you were clear, you were able to sort the cards, but the second person wasn't able to sort the cards. So you may end up having to apply your coding scheme. So you can see why this is in the high resource area, right? So I just gave you an example of classifying responses to one question, right? One question with 3 lines that people could fill out. Think if you had a whole focus group or 3 focus groups, right? You have to think about ahead of time whether you have the resources to do that kind of qualitative coding. Yeah. I wanted to tell you about some additional resources that I think might be helpful to you as you're engaging in conducting a focus group. And Leslie Curry has a really great series on YouTube about qualitative data. It's a little bit oriented around researchers, but especially if you're going to go the high resource route, I'd really suggest checking them out. The community toolbox, I gave you some links there. It has a whole section on conducting focus groups, and the checklist on the back of your form is from the community toolbox. If you poke around the toolbox, you'll see that every section includes a description, and every section has a checklist, which is pretty helpful. Every section has a PowerPoint presentation, so if you're asked to give a presentation on focus groups to your community partners, check it out. And then Pope and Mays wrote a pretty helpful book on qualitative research. And I don't know, Robin, did you have any additional resources to share?
No, I think I have some. I think yours are better.
Okay, I don't know, Alicia?
And I'll
Sarah?
share this with everybody too. We'll get
Yeah.
this in email, so.
Real world evaluation was also a really
Real
good.
world evaluation? Good, all right. Any questions?
I
Yeah.
have just a really general question. Is developing questions for individual interviews really a lot the same as doing it for focus groups?
Yep. Yep. And I think you have to have quite the same introduction question,
Right.
but you want a transition question, right? Yeah.
What do you think about using phenomenology for a focus group? The idea that you would try to have only one question and then dig deeper depending on the response.
I think that if it's appropriate for your topic, great, you'll get more depth. Yeah, yeah. I think a lot of times we're driven by pragmatics in health. Yeah, and so I think we're looking for responses that we can use in practice, and I think sometimes the approach you talk about gets there, but it's very much kind of led by the group, right? Yeah. What do you think about it?
Yeah, I mean, I think that's how I get to assess all my patients.
Yeah.
Just start with an open-ended question, try not to have a lot of preconceived notions. And we were talking about the one question here, and you said that question could lead to an answer. And when you have a contrived set of questions, you might come up with a contrived set of answers.
Yeah.
Where if you just had one more broad, general question, then depending on how that person responds, you could find out what's important to dig deeper.
Yeah, and there's a whole field that approaches qualitative analysis and asking questions and actually analyzing the data in this way. And I presented a little more structured way to go about it. It's more common in the health field because I think oftentimes we have a couple of different aspects that we want to probe about and want to learn about, and it's not a totally open question for us. Yeah, but that's a very appropriate way to analyze and ask questions too. Good, Yeah.
This is actually a survey question.
Okay, I'll do my best.
If you are implementing a survey, how many surveys do you need to collect for it to be statistically valid?
There is no easy answer to that question.
I was a
Yeah, sorry. Yeah. Yeah. It totally depends. Yeah.
I mean, I know.
It depends on your
more-
sampling frame and it depends on whether you actually want to generalize to another population or whether you're taking a convenience sample. I mean, if you're looking for data that is can be generalized to an entire population in a systematic way, you're probably going to want to look for existing data. My guess is it might be above your resources. So then you want to be looking at VRFSS data that are collected in.
And my question is, we're getting ready to launch a Missoula Community Health Survey in the neighborhoods that we just did walkabouts in. And there's 13,000 people that live in the 3 neighborhoods. And we're going to be mailing it, it's going to be online, we're doing door to door. We'll be working with community partners to reach our vulnerable populations. And I'm not sure what the right number is for getting collection back, so.
Ideally, it's 100% in that case, right?
Right. Well, yeah. Well,
yeah.
It's
because you're,
it's
yeah.
deeper,
Yeah.
sure.
And in that kind of situation, you're going to have respondent bias for sure. People are going to respond for a particular reason. And I think comparing one strategy would be you're going to get as many as you can, it sounds like,
Right.
and comparing the demographics of those that you, for the surveys that you receive against the population that you're interested in, and seeing how different they are, and the more different the demographics are, the less representative your sample is. That would be.
I kind of do want to compare it to Berthas and census and what's being reported there, and what we'll see in those neighborhoods.
Do you have access to?
Through policy map?
Yeah, because maybe there are some questions you could pull from the BRFOS at a neighborhood level.
Yeah, I'm using success measures.
Yeah, sorry, I don't know. Does anybody help with this?
It's a resource through Robert Wood Johnson or Reinvestment Fund, so this is all part of the planning grant to engage community residents, so it's a question that I'm asking them on Monday.
Yeah, that would be good to ask them, see what they say.
So
I mean,
I'm just curious.
in some ways you want to, if you're going to use this for community conversation, which is maybe what you're using this for.
To look at policies and planning.
Yeah, in some ways you want to have enough to make it meaningful to the community. It's another way to answer the question. It's not about statistical meaning, but it's about enough that we feel like our voices are represented.
Right.
I know that's not a very good answer, but
that's the
they're
goal.
2 separate answers.
Okay,
Yeah.
thank you.
It actually kind of has to do with what Lisa is talking about and really that bias, because I feel like with focus groups, how do you know that you're getting an accurate representation of the population that you want to sample?
Okay.
Because I feel like a lot of the people Lisa is talking about aren't going to participate in that focus group. So how do you really encourage those people that normally would not participate in that?
Well, let me just say 2 things. One, if you want to get information that's generalizable, focus groups is really not the way to do it, right? Because you're usually, it's a convenient sample, you're going after specific segments, and you're learning more in depth about an issue that you may follow up on. So when you do enough focus groups, you get saturation, you think, oh, I'm probably not going to learn anything more, and that's for the purposes of like brainstorming, right? You're not learning anything more about your brainstorming list. It really doesn't tell you a lot about how the population feels and how many endorse the issues that came up. And in some ways, I think you're in a mixed methods situation there, where you get your categories, understand what the issues are in a qualitative way, but then you can follow up with a survey or other method that is more quantitative. Because focus groups aren't generalizable, right? What you find out are not necessarily generalizable to the entire population, almost by design, right? Because you're going after a specific population. Yeah, really big difference.
This is more of a general question, but how often would you suggest that organizations and businesses do a focus group, versus subcontracting it out to a professional company or doing it within the organization, and what kind of the advantages of the 2 are?
anybody have any, I mean, I guess my first thought is it depends on your resources, right? I mean, if you can hire people out and they have the skill that you need to do the work, then you don't have to become an expert in a method. In my experience, the time that I have hired out, though, I have felt like I got a very surface report back. So it was really the top line report and not the kind of depth I wanted. So I guess I would just say that be careful in your contracting and exactly what it is that you want and what the purpose is.
Yeah.
I don't know. Robin?
I feel this, like I said, I've been involved in a lot of very non-professional setups for focus groups, and so there definitely I did all this as a freelancer, and so there were freelance situations where I really wish that they had contracted out because they didn't understand a lot of these pieces and parts when the organization was going into them. It sounded good, I think, and they wanted to do it, but they didn't do their research. But there were also, I had the same experience of having to write a report based on results from a professional group, and I looked, I'm like, I mean, it was so surface that I didn't feel like it really gave me much to write about. So I've had kind of the whole range. So I think if you were gonna contract out, you just would need to be really careful and really probably see the results of somebody's work before you signed up with them. Because actually, when I looked back through their stuff, and I wasn't in charge of hiring them, but I mean that's just how they do their work. So I would investigate it.
I think it's a good strategy, though. I mean, if you have a partner who knows how to do this, and contracting out seems like an efficient way to do it. I mean, we don't all have to be experts on everything, right? Yeah, good. I think one thing to think about within the health department is that you have expertise within the health department in a variety of these tools, and I think going through the kind of exercise of planning, like a little bit like what we did on our sheet, and I'm sorry went over, it is something that you can do in a brainstorming way, and I think you would have a better focus group as a result of the consultation. We should stop though, Robin, because
yeah, it's fine if you have.
I'll be around.
5 minutes and people want to stay and ask questions. Great. If you need to go, please go.
Yeah, I'll be here, so I can answer questions. But I know people have to get to things. I can see people are putting on their coats. Thanks, you guys.
Thanks so much, Mary. Appreciate it.